A client has obtained Plan B levonorgestrel 0.75 mg, 2 tablets as emergency contraception. After unprotected intercourse, the client calls the clinic to ask questions about taking the contraceptives. The nurse realizes the client needs a further explanation when she makes which of the following responses? A. I can wait 3 to 4 days after intercourse to start taking these to prevent pregnancy. B. My boyfriend can buy Plan B from the pharmacy if he is over 18 years old. C. The birth control works by preventing ovulation or fertilization of the egg. D. I may feel nauseated and have breast tenderness or a headache after using the contraceptive. Is the correct answer. Plan B is a series of contraceptive pills similar in composition to birth control pills that have been used for the past 30 years. Plan B is the brand name for levonorgestrel 0.75 mg. Pills are most effective if taken immediately after unprotected intercourse and then again 12 hours later. Males can purchase this contraceptive as long as they are over 18 years of age. Common side effects include nausea, breast tenderness, vertigo, and stomach pain. An antenatal G2, T1, P0, AB0, L1 client is discussing her postpartum plans for birth control with her healthcare provider. In analyzing the available choices, which of the following factors has the greatest impact on her birth control options? A. Satisfaction with prior methods. B. Preference of sexual partner. C. Breast or bottle feeding plan. D. History of clotting disease. C is the correct answer. Birth control plans are influenced primarily by whether the mother is breast or bottle feeding her infant. The maternal milk supply must be well established before the initiation of most hormonal birth control methods. Low-dose oral contraceptives would be the exception. Use of estrogen-progesterone-based pills and progesterone-only pills are commonly initiated from 4 to 6 weeks postpartum because the milk supply is well established by this time. Prior experiences with birth control methods have an impact on the method chosen, as do the preferences of the client's partner. However, they are not the most influential factors. A history of blood clots or thrombophlebitis is the second most important factor, as several methods will be eliminated because of their potential to place the client at risk for clotting disorders. After the nurse instructs a 20-year-old nulla gravida client on how to perform a breast self-examination, which of the following client statements indicates that the teaching has been successful? A. I should perform breast self-examination on the day my menstrual flow begins. B. It's important that I perform breast self-examination on the same day each month. C. If I notice that one of my breasts is much smaller than the other, I shouldn't worry. D. If there is discharge from my nipples, I should call my healthcare provider. The correct answer is D. The nurse determines that the client has understood the instructions when the client says that she will notify her physician if she notices discharge or bleeding, because this may be symptomatic of an underlying disease. Ideally, breast self-examination should be performed about 1 week after the onset of menses because hormonal influences on breast tissue are at a low ebb at this time. The client should perform breast self-examination on the same day each month only if she has stopped menstruating, as with menopause. The client's breasts should mirror each other. If one breast is significantly larger than the other, or if there is pitting of breast tissue, a tumor may be present. Assessment of a 16-year-old nulla gravid client who visits the clinic and asks for information on contraceptives reveals a menstrual cycle of 28 days. The nurse formulates a nursing diagnosis of deficient knowledge related to ovulation and fertility management. Which of the following would be important to include in the teaching plan for the client? A. The ovum survives for 96 hours after ovulation, making conception possible during this time. B. The basal body temperature falls at least O to F after ovulation has occurred. C. Ovulation usually occurs on day 14, plus or minus 2 days, before the onset of the next menstrual cycle. D. Most women can tell they have ovulated because of severe pain and thick, scant cervical mucus. The correct answer is C. For a client with a menstrual cycle of 28 days, ovulation usually occurs on day 14, plus or minus 2 days, before the onset of the next menstrual cycle. Stated another way, the menstrual period begins about 2 weeks after ovulation has occurred. Ovulation does not usually occur during the menses component of the cycle when the uterine lining is being shed. In most women, the ovum survives for about 12 to 24 hours after ovulation, during which time conception is possible. The basal body temperature rises 0.5 to 1 OF when ovulation occurs. Although some women experience pelvic discomfort during ovulation, Mittelschmerz, severe or unusual pain, is rare. After ovulation, the cervical mucus is thin and copious. Which of the following instructions about activities during menstruation would the nurse include when counseling an adolescent who has just begun to menstruate? A. Take a mild analgesic if needed for menstrual pain. B. Avoid cold foods if menstrual pain persists. C. Stop exercise while menstruating. D. Avoid sexual intercourse while menstruating. The correct answer is A. The nurse should instruct the client to take a mild analgesic, such as ibuprofen, if menstrual pain or cramps are present. The client should also eat foods rich in iron and should continue moderate exercise during menstruation, which increases abdominal tone. Avoiding cold foods will not decrease dysmenorrhea. Sexual intercourse is not prohibited during menstruation, but the male partner should wear a condom to prevent exposure to blood. After conducting a class for female adolescents about human reproduction, which of the following statements indicates that the school nurse's teaching has been effective? A. Under ideal conditions, sperm can reach the ovum in 15 to 30 minutes, resulting in pregnancy. B. I won't become pregnant if I abstain from intercourse during the last 14 days of my menstrual cycle. C. Sperm from a healthy male usually remains viable in the female reproductive tract for 96 hours. D. After an ovum is fertilized by a sperm, the ovum then contains 21 pairs of chromosomes. The correct answer is A. Under ideal conditions, sperm can reach the ovum in 15 to 30 minutes. This is an important point to make with adolescents who may be sexually active. Many people believe that the time interval is much longer and that they can wait until after intercourse to take steps to prevent conception. Without protection, pregnancy and sexually transmitted TED diseases can occur. When using the abstinence or calendar method, the couple should abstain from intercourse on the days of the menstrual cycle when the woman is most likely to conceive. Using a 28-day cycle as an example, a couple should abstain from coitus 3 to 4 days before ovulation days 10 through 14 and 3 to 4 days after ovulation days 15 through 18. Sperm from a healthy male can remain viable for 24 to 72 hours in the female reproductive tract. If the female client ovulates after coitus, there is a possibility that fertilization can occur. Before fertilization, the ovum and sperm each contain 23 chromosomes. After fertilization, the conceptus contains 46 chromosomes unless there is a chromosomal abnormality.